do I start?
Right now.
Till 8.
It's 8.
It is not.
Okay. All right, what is Oh. If you mute this here, mute that. No, mute it here. Yeah, don't put it up on it. Because they know that you're recording it.
All right, so I get rid of this. Get rid of that.
And then maximize that.
Maximize what? This?
That's not you, that's somebody else. Yep, so come up here, click on that. Yep. And then hit new share. Or where's your video at?
I don't know.
What'd you hit?
I hit new share like you told me to.
All right, let me sit down there real quick so people can see you. Let me go here.
It's being recorded. Where'd your video go? It's glitching on us too. Look at it.
There was one here that says stop video.
That's perfect, but where the heck are you? So many credits. There we go.
Oh, that's your. I'm like, what is 830 Chester Family Medicare?
Hey, there you go.
All right, am I recording?
You're recording.
All right. Hand me that, please. Oh yeah, loads. What do I do when I'm done?
Just come in.
Okay. Good morning, everybody.
Good morning.
Today is Thursday, January 25th, and I am David. and today I am going over the CMS regulations and conditions of participation requirements for the emergency preparedness portion of home health services. There are going to be several different parts that you need to be aware of. I am going to start off with the disaster triage code. It is a requirement that we assign each patient that we have a disaster triage code. So in case of an emergency, we know what level they are and what steps we need to take to make sure that they are safe in the event of an emergency. It is located in the patient's chart under their administrative screen. It is the same place you go if you are changing the admission settings and stuff like that. In our system, Brightree actually has them listed as 1, 2, 3, and 4. And the reasons they have listed under each one do not quite make sense. So I'm going to explain what each level should be for our purposes. Level 1 in the system says scheduled visits should not be missed. For our purposes, level 1 are the patients that absolutely need to be checked on or are in a situation in which we need to make sure they have assistance in case we cannot get to them. These patients are typically going to be the completely bed-bound patients that do not have caregivers in the home. So in case of an emergency, if they are in the home by themselves and they cannot get out of bed, they are the ones that need to be checked on. These are also the patients that we need to make sure are registered with the local EMS for their area so that they know in case of an emergency that if they call 911 or that they should at least be checked on. A couple of examples of those, not everybody knows all the patients, but we have a patient here in Colonial Heights, Donald Radcliffe. He is completely bedbound. Once he is in bed, he cannot get out on his own. He has to have human assistance. He's a quadriplegic. He does have aid services during the day, but during the night, he is put in bed, and then he is completely alone. He stays in that home by himself. He does have his phone. He would be a level 1 because if we had a huge blizzard or an earthquake or something of that nature, he is one that we as his home health agency should be calling the rescue squad saying, we need him checked on, he is bedbound, please go check on him, because we physically can't get to him and the services could. Level 2 is basically going to be 90% of our patients. These are patients that cannot get out of the homes by themselves, but they do live with caregivers. They have family in the home. They have resources that can help them get out. They can actually get out of the home. They just need some human assistance. So that is what level 2 means. In the system, it says, scheduled visits can be missed. Just ignore that. These are going to be basically 90% of our patients. Level 3 says skilled visits can be missed. Level 3 patients should only be the patients that we are servicing that live in some form of facility, whether they're in assisted living like the Dunlop House or a group home that is medically run like the ARCs, or group homes where they have people there with them 24 hours a day. They have their own evacuation plan. They have their own backup plan. So those are the patients that we do not have to directly and concern ourselves with to make sure that they're safe and can get out of the home. They have their own backup plans. So those are the level 3s. Level 4 in our system says patients with electronic equipment, oxygen, stuff like that. We're not really going to use that. Let's use the 1, 2, or 3. But just know that if a patient does have oxygen, like a concentrator, or have electrical equipment that need electricity. These are the patients that we're probably still going to mark twos. They have people in the homes that can help them, but these are the patients that we want to call Dominion Energy and say, I just want to put them on the list. If their power goes out, they're going to need, power back as soon as possible. It's just that extra step to make sure that they're going to be taken care of. So that is the disaster triage. Now, this is done upon admission. So the admitting clinicians, nursing therapists, whoever it is, based upon your assessment and what you find in the home, you should be the one initially setting that triage code. But for everybody else, if we are treating the patient for a couple of months and the situation changes, you can go in and change that disaster triage code. If you have somebody that has somebody in the home with them, then there are two, but let's say a month and a half down the road, that caregiver's got to go back to Florida. And now that patient's by themselves and they need somebody to get out of the home, we can change them to a level 1. So the disaster triage is an ongoing assessment to make sure that the patient is safe. So again, based on the disaster triage code, if you have a level 1, a bedbound patient, we should be calling the local EMS for that area saying, hey, I want to register this patient as a priority in case of emergency because of these situations. And then again, anybody with oxygen, you want to call Dominion Energy and say, I want to make sure I register this person to make sure that if their power goes out, they actually have a need for it. So I'm going to step down a little bit with that one and go off. One of the emergency preparedness things that we do, especially for patients with oxygen or electrical equipment, if they have electrical equipment, we want to encourage them to have a generator. Do they have a generator? They should have one. Generators usually last 2 to 3 days, and Dominion Energy actually says you should have enough for 3 days because that's the typical amount of time when a mass outage occurs. Also for the oxygen patients, if we know an impending storm is coming with the possibility of an outage, you want to make sure that they have at least 3 days of backup oxygen tanks because, again, it can take up to 3 days. So if the patients are going to call, their Apria or Robert's Oxygen or anything like that, we might also want to call and say, hey, this storm is coming up next week. The patient only has 1 tank of oxygen. Can we get them some more backup so that they don't run out in case they run out of oxygen? I didn't really prepare for this, so just go with it. All right. The next thing I want to talk about is our emergency call tree. Now, we have used it twice now in the past month, both due to the inclement weather with the snow. What the call tree is, the first time we activated it, a lot of you didn't really know what it was, what the requirements were for it. Basically, the emergency call tree is initially activated by Joe, Brent, or Kathy. They are the top of the tree. They are the ones that are going to decide whether we need to delay openings in that situation. And what happens is they initiate it. They send the text out to the people they text, usually Melanie and the management staff. They send it down to theirs. And ultimately, for the clinicians in the field, it comes down to your team leaders, Garth and Amanda at this point, and there may be more as we grow. So they will get the text saying and giving instructions, the office is delayed, this is the situation, this is what you need to do. They will then send the text to their team. One of the things that you need to make sure you do when the tree is activated is that we need the communication back that you got the information. Even if you just text back, okay, I got it, I'm on it, message received, something so that Garth and Amanda know, all right, they got the information, they know what to do. Once it gets down to your level, your responsibility at that time is to call your patients for the day, triage your patients for the day. You know, are you okay? You know, do you know what your neighborhood is like? Am I going to be able to get to you today? I will try to get to you today. Situations like that. We just want to make sure that the patient is taken care of and everything. And then after you have communicated with your patients, it's important again for you to communicate back with the management team and the scheduling team to let us know if anybody has issues or what we have to do to prepare. The fortunate thing is that I am actually registered with the CDHC, the Central Virginia, or CDCH, Central Virginia Healthcare Coalition. And they actually email me alerts. So if we know that a blizzard is coming tomorrow, I actually start getting the predictions and everything like that sometime today. And as I get that information, I pass that up the tree so that they can make the determination. And then the information we sent you is based on that. So a lot of times, if we know it's coming the next day, you're actually alerted, and then the tree is pre-started when you get the text, schedule is set, inclement weather is coming, please make appropriate plans. So that is what the call tree is for, and that is how it works. And again, the most important thing for you to do, the two most important things for you to do is communicate with your patients and make sure that they're taken care of, and then of course communicate back to us so that we know you got the information and we know you're taking care of the patients. So that is the emergency call tree, and if at any point you have any questions about it, please feel free to call us, please feel free to talk to us. Another part of the emergency call tree is we have a list of employees with four-wheel drive. Some of them are the clinicians, and the last couple of times that we've activated it, they're like, hey, I've got four-wheel drive, I've got this, I'm going to go out and see my patients. And then the only patients they didn't see were the ones that they just physically couldn't get to. But we do have staff here in the office. Brent has four-wheel drive, Melanie has four-wheel drive. There are several people with four-wheel drive that if you have a patient that we really need to see during the day, but you don't think your car is going to get there, we have somebody that can come pick you up and get you to that patient and then take you home. So we need to start utilizing that. That way, you know, we know the patient is taken care of and we have access to them. So that's another part of the call tree, is that you make sure you utilize all the resources we have. Second, another part of the emergency preparedness is to make sure that you have all of your proper PPE, the personal protection equipment. This isn't just for inclement weather. You gotta know emergency preparedness is for any natural disaster, earthquakes, hurricanes. It can also be for an epidemic, a terrorist attack, anything of that nature. So the personal protection equipment that you have basically is for any kind of epidemics. If there is a huge epidemic, do you have the face mask? Do you have the N95 respirator mask? Do you have the gowns? Make sure you have the gloves. Make sure you have hand sanitizer. This is all stuff that we do provide for you upon the orientation and when you initially get your equipment. But if you use it, it's up to you. It's your responsibility to make sure you come back to the office and say, okay, I had to use this. I need another one. It's because your safety is more important than the patient's safety at this point, because without you, the patients just don't get taken care of. So just go through, double check all of your personal protection equipment. If it's damaged, if it's outdated, if it's expired, some of the stuff does expire, please make sure you come in and get it changed out. Anna, Tarika, whoever's doing the equipment, know where it is, and they'll definitely make sure you have that information. Give me just a second. All right. Another part of the emergency preparedness that we encourage, and we actually learned through several of the meetings that I have gone to, hello, is that, yes, one of our priorities is making sure that the patient is safe and that the patient is taken care of. But again, our employee safety and preparedness
yeah.
is also very important.
Hoping that it's gonna
Hey,
be
whoever's talking, please mute.
1:30, 2 o'clock.
Yeah, that's great. I love 1:30, 2 o'clock. Can you please mute?
Bye-bye.
Thank you. You need to make sure that you yourself are prepared. Do you have water or some kind of food in your car if you are out and you get stuck someplace for a while? Do you have extra clothing? Do you have a blanket if you are stuck in a snowstorm, you know, to keep you warm and it's going to be a while before somebody can get to you? Just make sure that you yourself are prepared, especially in your vehicle, because when you're out on the road, we go to some very far out places. We go to Stony Creek, we go to Powhatan, we go to a lot of places where if you're stuck on the side of the road, there's not always traffic coming by all the time for you to get immediate assistance. So just make sure you have some extra stuff in your car. Clothes, food, water, blankets, anything like that. If you actually have, you know, road flares or anything, it's good to keep that kind of stuff in it. You also want to make sure that you keep your phone charged. Do you have a charger for your car? Because I would hate for you to be stuck in Stony Creek in the middle of a snowstorm and your phone's dead. You can't call anybody, and again, not many people are driving by for you to get assistance. So you make sure your phone is charged. Another thing that we encourage is, are you prepared at home for an emergency? Do you have enough water in your home for each, you know, a 3-day supply for each person in your home of water, of food, and your pets? Do you have enough food for your pets, supplies for your pets? We want to make sure that you're safe in the home, that your family is safe in the home. Do you have a generator? Do you have candles, flashlights, extra batteries, radios, anything like that? Anything to help prepare yourself in the home. Because again, I don't want you having to go see patients and then the entire time you're out seeing patients, you're worried about what's going on at home. Now, you're going to worry about what's going on at home no matter what, but you're going to feel better about what's going on at home, that if you know they've got water, they've got food, they've got another heat source, they've got batteries, you're just going to feel better knowing that they're already taken care of while you're out seeing patients, doing what you need to do for your patients and everything like that. So we strongly encourage that not only are you teaching this to your patients to be prepared, that you yourself are prepared, that your family is prepared, that you know everything is going to be safe. And if you have any questions about what you can get, where you can get stuff, I can find the resources and help you plan for your home and help plan for the patient. So please come to me. I can Google things, I can contact the CDHC and get checklists from them if need be. The last thing I'm going to talk about at this point is in the admission packets, we actually have for the patients the emergency preparedness plan for them to fill out. And CMS regulations and guidelines, we have to make sure the patient is prepared. We have to do everything we can to show that we're getting them prepared. That's why we put that packet in their folders. That packet basically, it lists, you know, the hospital, it lists their doctor's number, it will list their emergency contacts, you know, who are they going to call? Do they have an evacuation plan? Do they have a way out of their neighborhood if they're in a cul-de-sac and a hurricane hits? Do they have an out-of-town contact? Do they have somebody that they can call that they can get assistance from that hasn't themselves been infected by whatever has affected this area? It is very important that you fill that out, not only for the patient's safety and for their peace of mind, but the surveyor is going to look at it. That is going to be a very big hot ticket button for the next survey when they come through. CMS has told us, the CVHC has told me this. They are going to look for that. They are going to open that folder and look for that. And if it is not filled out, that is a ding on us. That is not a good thing. So do it upon admission. If you're doing a follow-up visit on a patient and you glance in the folder and you don't see it filled out, take 5 minutes to please just fill it out. Hey, you know, what's your daughter's number? Let's make sure they're listed in here. You know, what's your doctor's number? It also has, you know, certain medications for them to write down, allergies, health conditions, anything like that, so that if EMS has to come pick them up, they can give them that pamphlet, and then the EMS has all that information also. So it's very important that you fill that out. And if you go to the patient's home and they don't have one in their folder, please get one from the office and take it to them. If you want to grab a couple extra and have them in your car, that's not a problem. We need to make sure that they have it. They need to have this information. So again, the whole purpose of the emergency preparedness, the whole purpose of the emergency planning is twofold. We want to make sure that the patient is safe. We want to make sure that the patient is taken care of. Once we admit them to our services, they are our responsibility. It's just as if they were admitted to a hospital. If I was in a hospital and a hurricane hit, it's the hospital's responsibility to make sure I'm safe because I am in their care. Once we admit them to our services, they are in our care. It is our responsibility to make sure that they are as safe as they can be, and whatever we need to do to help them plan. But it's also our responsibility to make sure that we ourselves are taken care of and that our clinicians are taken care of. So you need to prepare for an emergency, not only for yourself, but for your family, including your pets, and stuff like that. If you have any questions about any of things that I have covered today, please feel free to come to me. Please feel free. You can call your local EMS providers. They actually have a lot of information. You can call the non-emergent police dispatch and ask questions. Make sure you have phone numbers handy and everything like that. Today's word of the day is disarticulation, just because. So make sure that when you watch this, you let Melanie know that you have seen it. You have sent her that word. Again, disarticulation. Thank you very much for joining. I am hoping that we can get this taken care of. I hope that we are looking out for our patients, and I really hope that you're looking out for yourself. So thank you very much. Have a wonderful day, and be safe out there. Thank you. How do I turn this off? Good morning. Hey, Brent, how do I turn this off? I don't know how to stop. I hit stop there. I'll tell you where it is. All right. Do you get to be the Trika today? Yeah. Yay. I thought it was Joe, what you want? I got a chuckle out of that this morning. That gives me